your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. Now I'm a budding YouTuber. So, uh, in in pursuit, I'm in pursuit to address, promote, and propagate Ayurveda and psychotherapy globally. So in this discourse, I come up with discussions on Ayurveda, mental health, psychotherapy, and all the related aspects every week. So today's topic of discussion, as you can see, is in my background, is postpartum depression. So usually the newborn mothers and most of the women, requests from the women I get from for this topic, that is postpartum depression. So postpartum depression, we all know about it, but exactly what happens in postpartum depression, what does Ayurveda think of Ayurvedic view of postpartum depression, what are the causes of it? First we discuss the modern aspects of postpartum discussion. Then we are going to discuss about the Ayurvedic aspects of it as well. So today, as we talk about postpartum depression, you can see in my background that approximately 1 in 10 birthing people will experience postpartum depression, after giving birth. See, there is a difference between baby blues and postpartum depression. So we'll know everything about it. And if you are a professional pertaining to mental health, or an Ayurvedic psychiatrist or a psychotherapist or an expert in any of the fields in Ayurveda, I welcome you to talk on your success stories of the successful case studies and share it with us in a collaborative session, so that we can share it together to the world, because my motto is to spread Ayurveda and psychotherapy globally. So I welcome all your expertise, and if you have any thing specific or peculiar results in any kind, in any of these aspects, feel free to share your expertise in the comment section in the LinkedIn or YouTube, so that we can have a discussion on this. We can collaborate and have a discussion and make people more informed. So let's get started without wasting any time. See, definition: having a baby is a life-changing experience, as everybody knows. Being a parent is an exciting, but at times it can be tiring, and overwhelming too. It's normal to have feelings of worry, doubt, especially if you are a first-time parent. A first-time parent will have n number of doubts, ambiguities, worries, anxiety, and they'll keep on researching things. So some new moms experience a more severe, this is common what I said, but for some new mothers, they experience more severe and long lasting form of depression, that is known as postpartum depression. Sometimes it's called a peripartum depression, because it can start during the pregnancy and continue after childbirth. Sometimes it is also referred as peripartum. Peripartum is during the pregnancy. So, postpartum depression is a type of depression that occurs after childbirth usually. What is it? It is characterized by the feelings of sadness, hopelessness, worthlessness, which can significantly affect the new mother's ability to care herself and her baby. What happens is, when a mother has postpartum depression, it not only affects the mother, it also affects the child, the baby. So, in medical terms, if I have to say, postpartum depression is a complex mix. It is a mix of physical, emotional, behavioral changes that happen in some women after giving birth. So according to the DSM-5, a manual used to diagnose, it is a manual which is used to diagnose mental health disorders. See, postpartum depression is a major form of depression that is mentioned over there, and it usually begins, it is said that it is usually begins after or within 4 weeks of delivery. And the diagnosis of postpartum depression is based not only on the length of the time between the delivery and the onset of the severity of the depression. So, in most of the cases, what happens is postpartum depression is either diagnosed very late or it is not even diagnosed. So, see, as I said, there is something called baby blues. See, it is common for women to experience the baby blues. That means feeling stressed after giving birth, feeling sad at times, feeling anxious, feeling lonely, feeling tired or BP, because there are many sleepless nights initially when the infant, initially for the first 3-4 months when you have to feed the infant for every 2 hours, and all these after following the baby's birth. But all this is common, to feel a bit stressed, anxiety, sleepless, lonely, tired, and you sometimes feel like a BP or sad. See, up to this much it is normal, but if it extends beyond this, in some women, up to that is up to 1 in 7 women who give birth, or 1 in 10 women who give birth experience a much more serious mood disorder. That is called postpartum depression. And there is also a severe disorder which is called postpartum psychosis. Though it is not, though does not occur in many of the, many cases, but it is very rare. But there is a term called postpartum psychosis. We will discuss that in some other session. See, that is a psychotic we call it, that is severe, because they have delusions, they have hallucination, that is severe, that is completely different from the postpartum depression. See, in postpartum, unlike the baby blues, in the baby blues we'll also discuss what is baby blues and what are the symptoms, but unlike the baby blues, the postpartum depression will not go away on its own. Baby blues will go away on its own. Whatever I told, that feeling a bit of stress, feeling a bit of sadness, anxious, you have so many ambiguities, so what to do, what not to do, and you're tired, you're sleepless, all these things go away on its own. Once you get a proper sleep, once, the stress is reduced after 1 to 3 months, all this comes down. But here in postpartum depression, this requires treatment. See, what happens is, in postpartum depression doesn't go away on its own. It can appear days or even months after delivering a baby. It can last for many weeks. Or months if left untreated. So, postpartum depression can make it hard for a person to get through the day, and it can affect your ability to take care of your baby or yourself. See, what happens is, as I said, I have said it n number of times, it is called a mental health disorder only, whether it may be postpartum depression, whether it may be stress, whether it may be depression, whether it may be anxiety. What happens is, your daily routine is affected. You're not able to function as per your daily routine. Your productivity gets hampered. So in this case, what happens is, the mother, the new mother is unable to take care of herself and her baby, and her daily routine is, hampered, like disturbed. So this situation is called postpartum depression. So, and if this those with easy pregnancy, see, and some common causes of, see, next we'll see what are the causes of postpartum depression. see, this is not only, and another point I have to say, that people ask me that is postpartum depression only for new mothers or first time mothers? No, it may happen to not only to the first time mothers, it may happen to people giving birth second time or the multiple time. It might happen. We will discuss about the causes of postpartum depression in the session itself. And who are not, regardless of, it is not regarding any race, ethnicity, culture, education. People ask me, is there any distinction that educated mothers or non-educated mothers are more affected due to postpartum depression? No, it is not like that. And if unmarried mothers or are more affected, no, it does not differentiate like that. It does not happen like that. It can happen to any women. Postpartum depression, why it majorly happens is maybe because of the hormonal changes in women. In pregnancy, there is a lot of hormonal changes happening, and after giving birth also some hormones come down, estrogen and progesterone. After giving birth, there is significant drop of the hormones, so that may be the cause. Or lack of sleep. As I said, there are many sleepless nights for a mother because of the constant feeding or the crying of the baby, or if the baby doesn't sleep well. If a lack of sleep may also be a cause. And physical discomfort after childbirth, it requires at least 1 to 6 weeks for a mother to recover from the delivery. There will be physical discomfort and physical symptoms. Because of that also, a mother gets irritated and may have mood changes. And next is a history of depression. If a person has a history of depression, or her parents, if they have her parents or her relatives, any close relatives have the history of depression, they might also develop postpartum depression. Or if they have the history of anxiety or any mental health disorder in general. And if the social and relationship life is disturbed, if the relationship in a relationship between a couple, or for women there is a relationship conflict, that also might result in postpartum depression, because she might not have the social support, or she might not have the support of the spouse and the parents and the in-laws. And what happens is, because of not having the support, she might feel isolated. She might feel isolated and lonely, and this might also lead to postpartum depression. So what happens is, if you are experiencing and what are the factors? People ask, what are the factors that increase the risk of being depressed after birth? See, as I said, if you have a genetic factor, that is, you're having a personal or family history of depression. See, if you have a personal or family history of depression, and limited social support, marriage or relationship conflict, and pregnancy complications like health conditions, difficult delivery or premature birth, if there are pregnancy complications, and even if it is unwanted pregnancy, or the ambiguities during the pregnancy, if it is an unwanted child, or a child from the sexual violence, then also there are greater chances of developing postpartum depression. If a new mother is younger than 18 or 20 years of age, see, the body and the person should be mentally and physically ready to have a child. So if a person is very young, that is less than 20 years of age, having a baby with special needs. When a mother gets to know that her baby is with a special needs, with Down syndrome, or needs special care, and the baby is not normally, the baby is not normal, then, or the baby cries a lot, and if all that happens, when if the baby has health issues also, it is not normal, or it is special needs baby, then also mother might be get disappointed and develop postpartum depression. See, the exact causes of the postpartum depression are complex. Matlab, there is no one cause which says that this might cause postpartum depression. For different individuals, for different mothers, there may be different causes, and it differs from person to person. So there are several factors, anyways, which impact and which contribute to postpartum depression. That is hormonal changes. As I said, after childbirth, there is a significant drop in estrogen and progesterone levels, which can affect mood regulation and contribute to depressive symptoms. Biological factors, that is changes in the brain chemistry and neurotransmitter level, also can play a role in the development of postpartum depression. Psychological factors, that means a history of depression, anxiety, and other mental health issues can increase the risk of PPD. And other factors like low self-esteem and negative body image. Sometimes what happens is when there is a newborn mother feels insecure about her body, changes in the body, changes in the body weight, people reacting to it. Frequently people tell to you have your weight has increased. All those things also might contribute to developing the postpartum depression. Emotional and lifestyle changes, the stress of caring for a newborn, sleep deprivation, adjusting to the demands of the motherhood can lead to increased vulnerability of PPD. See, a mother is not born with, or not a PhD with how to take care of a newborn. So she is in the learning phase. So due to the emotional and lifestyle changes also, she might develop postpartum depression. Lack of social support from partner, lack of support from the family, lack of support from the friends or in-laws or parents, and feelings of isolation. See, mainly feelings of isolation can contribute to the development of postpartum depression. Relationship issues, strained relationships with a partner or conflicts within the family can contribute to onset of PPD. See, the global incidence of PPD here is postpartum depression, varies widely due to differences in cultural practices, healthcare access, and awareness. Awareness also sometimes plays a role. What to do, do's and don'ts. People who have poor access to healthcare, mothers who have poor access to healthcare, who have given home birth, also they also might develop, because they are unaware of some of the things, so they might develop postpartum depression. There are chances of developing, that is 10%, around 7 to 10% of women who have given birth experience postpartum depression after giving birth. See, these numbers are, significantly higher in certain regions, lower in certain regions, and, there may be additional stresses for them, limited resources, less awareness about the mental health issues as well. So, it is like, see, there is something called, I said, postpartum blues or baby blues. I think some of you might heard of the word baby blues, because it is more talked about these days. So the baby blues, affect between 50 to 75% of the women, the newborn mothers after delivery. This is more common than postpartum depression. So what happens is, if you are experiencing baby blues, that means you will have frequent and bouts of crying, sadness, anxiety, ambiguity, what to do, what not to do, sleep disturbances. The condition usually begins in the first week, so 1 to 4 days after delivery. So in the beginning, it is in the initial stages after delivery. Although the experience is unpleasant, the condition usually subsides within the 2 weeks. Once you adjust or adapt to the changes, it subsides. It usually subsides by itself. The best thing you can do is find support and ask them for help. You can ask your help from your spouse, family members. So the support, equal support, 50% support from the spouse, from the family members, from the in-laws, from the friends, from the siblings is necessary when for a new mother. So the best thing she can do is ask for help and find support. So symptoms are, these symptoms last for few days to 1 or 2 weeks maximum, and it subsides on its own. What all happens? Mother can feel sad, mother can feel irritable, mother can feel overwhelmed, mother can start crying. She might have reduced concentration, appetite problems, and there is obviously sleep deprivation or a trouble sleeping. That is some of the mood swings. She will experience some mood swings. So this is different from the postpartum depression. So what happens in the postpartum depression is it is far more serious. It goes beyond only being sleep deprived or being sad or being irritable for a few days. This does not end or subside in a few days. It might last up to 1 to 3 years. Postpartum depression. See, the postpartum depression is a far more serious condition than the baby blues, affecting about 1 in 7 parents. If you have had postpartum depression before, your this increase 30% more in next pregnancy as well. So this point I forgot to tell. That means if you have experienced postpartum depression in your first pregnancy, there are 30% chances of it relapsing in the second pregnancy. So this might also happen. So see, a mother may experience alternating highs and lows, frequent crying, irritability, fatigue. Fatigue is, being always feeling tired, as well as feelings of guilt. Here, there in the baby blues, there is no feelings of guilt or worthlessness, or, you don't have the low esteem. But here, the esteem is reduced. There are feelings of guilt, there are feelings of worthlessness, and inability to take care of the baby and herself. So what it happens, the symptoms range from mild to severe. Here it might start from mild to severe, and it may develop gradually. Might not be seen in the first days of delivery after giving birth. This postpartum depression might start gradually and take even up to a year. Although symptoms can last several months, treatment with psychotherapy, the psychotherapy or the talk therapy, getting proper counseling, group therapy, support from the family, all these will, help in reducing and managing postpartum depression that will subside with time. So postpartum depression sometimes will be mistaken for the baby blues at first. People will not recognize the postpartum symptom and they will tell, अरे baby blues है अभी बच्चा पैदा हुआ है ना तो changes की वजह से आपको ऐसा हो रहा है करके. So, but symptoms here are more intense and last longer. This may, as I said, what happens is it eventually interferes with your daily ability to take care of yourself and your child. So, and to handle other daily tasks. So, symptom, as I said, usually develops within the first few weeks here after giving birth, but they may begin earlier. See, as I said, that is peripartum. So, it might begin, during pregnancy as well, or later up to a year of after birth. So, What are the symptoms here? Depressed mood or severe mood swings. That means the mood is not predictable. 1 minute she'll be very, 1 minute she'll be calm, and the next minute she'll be very irritable, very angry, maybe very aggressive at times, and crying, too much of crying. And the main thing is difficulty bonding with your baby. That means what happens is sometimes mother may not like her child. It is difficult for her to bond with the child, and what happens is eventually she withdraws from the family and friends. What I said is isolation might cause PPD, but what happens in PPD, she wants to be isolated. That means she does not want to meet family or friends, or she want to be alone. She wants to be alone. Either she doesn't eat anything, there is loss of appetite, or she starts eating too much than usual. Both might happen. That means she might lose interest in food, or she might eat too much. Both might happen. Inability to sleep, that is called insomnia, or sleeping too much. Both might happen. Here also both might happen. Either she will have either she is sleep deprived, or she sleeps too much. Sleeping too much happens in rare cases, but usually it is sleep deprivation. Overwhelming tiredness and loss of energy. She is not interested in doing anything, taking care of the baby, feeding the baby, bonding with the child. She is not interested in anything or doing any daily activities she used to enjoy earlier. Loss of interest, as I said, loss of interest, less interest in and pleasure in the activity she used to enjoy. Intense anger and irritability. Fear that, and she will always have the fear that she is not a good mother. Here the feelings of guilty, feelings of being worthless, and hopelessness, and I'm a hopeless mother. Feelings of all this will be there: shame, guilt, inadequacy, everything. And clarity of thinking clarity, concentration to and make decisions. All the ability comes down here. Reduced ability to think clearly, concentrate, or to make decisions. Restlessness, because she's sleep deprived, and there is disturbance in the appetite. She's always restless. There may be severe anxiety and panic attacks. This is not very common, but people may experience panic attacks. Thoughts of, this is in severe cases, thoughts of harming yourself or your baby. This may be the case, but not very usual. But thoughts might come of harming either herself or her baby, her child. And this is also rare, but recurring thoughts of death or suicide, that means she has to die. So all this, untreated, if these symptoms are untreated, this might become more severe. So if anybody in your family or friends or in group, any mothers are experiencing this, please approach a mental health professional, that is psychotherapist or a psychiatrist or a counseling psychologist, as per the requirement. So the after talking, after counseling, once they talk to a psychotherapist, or once they share their feelings, their thoughts, once their concerns are addressed, the problem starts coming down. And if they have any physical symptoms, that also needs to be treated. See, as I said, there is a more serious condition called postpartum psychosis. Though this is not common, not very common, but this might, it is extremely, severe form of postpartum depression. And this is an emergency medical condition. So, it affects maybe 1 in 1,000 mothers after delivery, only 1 in 1,000. So, the symptoms generally, what happens is they quickly after delivery, this happens quickly, noticeable after the delivery, severe, lasting for weeks to months. That means people can observe it immediately. And symptoms include severe agitation, confusion, feelings of hopelessness and shame, insomnia. Paranoia is, in front of others only, she might try to harm the child, or she might try to harm herself, or she might have some hallucinations that somebody is going to harm her, or somebody is going to harm her child. Hyperactivity, rapid speech, talking alone, lonely, talking to herself, all these things. And this postpartum psychosis requires immediate medical attention, since there is an increased risk of suicide, and increased risk of harming the child as well. So, and this here, only psychotherapy might not be sufficient. Hospitalization may also be required at times, okay, and medications as well. So, this is postpartum psychosis. Now, coming back to postpartum depression, here what happens, the symptoms, as I said, I'm just gonna repeat: persistent sadness, see, feeling overwhelmingly sad, hopeless, being in low mood, and loss of interest here, losing pleasure in activities she used to enjoy earlier, fatigue and sleep disturbances, appetite changes, difficulty concentrating, irritability, feelings of guilt or worthlessness. Withdrawal is withdrawing from the social activities, withdrawing from the social gatherings, withdrawing from the work, you know, withdrawing from or avoiding friends and family, and isolating herself. This is the thing. Or she might avoid the child as well, baby as well. It becomes really difficult for the child to bond with the mother. And physical symptoms here is experiencing, sometimes they may experience physical symptoms such as headaches and abdominal aches, stomach aches. These are unexplained aches and pains. So usually the pains and aches are here unexplained. Matlab, it is different for different individuals here. Anxiety, feeling anxious, worried, or having panic attacks. This is a severe form. Sometimes accompanied by the physical symptoms like increased heart rate. All these might happen, or shortness of breath. All these might happen. This is not very common though. And intrusive thoughts. Intrusive thought is having negative or disturbing thoughts, and not feeling happy. There is a happiness. There is, even though there is nervousness, mothers are generally really happy and excited for the child, to bond with the child. But here in this case, it is not so. They have no excitement and no interest of bonding with the child. See, difficulty bonding with the baby is a major challenge. So, struggling to form an emotional connection with the newborn, feeling detached, experiencing thoughts of harming the baby, harming herself, all of these things. So, and now we are going to discuss what is the impact of that impact of postpartum depression on the mother and on the baby. Now we have discussed about the mother, and now we are discussing about mother and the baby. What happens to the baby if mother is experiencing postpartum depression? There is impact on baby as well here, not only the mother. So for mother, the mental health is impacted, the physical health is impacted, the bonding and interaction is impacted, the self-care is impacted. Mothers with the postpartum depression here neglect their own self-care, including proper nutrition, exercise, medical checkups. They are not interested in taking self-care. They are not interested in bonding and interaction. They are not interested in, their relationships might be strained because of, with their partners, with their families, with their friends, with their work setup, and delayed recovery. What happens is, in postpartum depression can hinder the mother's postpartum recovery. Postpartum recovery usually happens within the first 6 weeks or first 9 weeks. Here it takes much time, and the recovery is very much delayed. It impacts physical, psychological and emotional well-being of the mother. So how does it impact the child? Of course, child also needs attachment and bonding. So the quality of the mother-child bond might be compromised. So if there is the mother-child bond is compromised, it is very crucial for child's emotional development and sense of security. The child gets a sense of security, and the emotional development of the child is through the bonding of the mother and the child. If the bonding is impaired, there is a huge impact on the emotional development of the child and sense of security. And child may in later life develop mental health disorders as well. And developmental delays, it is observed that children of mothers with untreated postpartum depression experience developmental delays. That means milestones are delayed as the mother's emotional availability and engagement play in a role of in the child's cognitive and social development. See, the role of mother is very important in the child's development. Milestone development, whether it be sensory, whether it be motor, it is the mother who teaches the child. First guru, prathama guru is mother. So if the mother is having postpartum depression and which is untreated, what happens is the baby suffers due to developmental delays. Maybe the crawling, the walking, or the sensory delays, differentiating colors, motor, sensory and motor development, and social development, engaging with people, all this may be delayed, and then behavioral issues. See, children of mothers with postpartum depression exhibit more behavioral problems. Matlab, they also might develop irritability. They also might, feel difficulty in self-soothing. After the child, it becomes from infant to a toddler, there is a self-soothing mechanism which develops because of the mother's bond. But here, there is difficulty in self-soothing and trouble regulating emotions. Children also cannot, regulate their emotions because they don't find the love and affection and the bonding. They might experience cognitive problems, cognitive functioning difficulties. That means it affects cognitive is thinking and clarity, thoughts and clarity. PPD can indirectly affect the child's cognitive development as the mother's state of influence, her ability to engage in enriching activities and provide a stimulating environment. So because of this, cognitive function might also be impaired. The physical well-being can also be affected. If the mother is not feeding the child on time, there may be development of nutritional, lack of nutrition. The child may develop physical, problems, physical health problems as well. And emotional well-being is certainly affected. So children can be more prone to developing emotional and psychological issues if their primary caregiver is struggling with PPD. So early detection and treatment of PPD, that is postpartum depression, are crucial to mitigate these potential negative effects. All these can be avoided. If the mother gets the social support of the family, support of the friends, support of the siblings, support of the colleagues, and mental health support. So this can bring all this down. So effective interventions can improve the mother's mental health, enhance the relationship and the bond with the child, and contribute to the child's healthy development. So it is very much important to get a help. So what does Ayurveda have to say about it? I'll discuss it in brief today, and we'll discuss it in detail in the next session. So see, Ayurveda recognizes the postpartum period as a critical phase for both the mother and the newborn. Ayurveda also tells says the same. It was told years ago, like 5,000 years ago. While Ayurveda, explicitly there is no term called postpartum depression, but see, it is called Sutika Avastha. Postpartum period is called Sutika Avastha, And Ayurveda explains that what all to be done to various aspects of mental health and maternal health and mental well-being, and the management of emotional imbalances during the postpartum period. Ayurveda also says that in Sutika Avastha, that is in the postpartum period, a mother will have, a maternal, concentrating on maternal mental health and emotional imbalances is, of prime importance. So, in Sutika Avastha, need for proper care to ensure mother's physical and mental recovery is very much important. So balancing doshas, what here is done is balancing the doshas in the mother if there is any vitiation. So, and the nourishment and rest, that is diet and lifestyle. In Ayurveda, diet and lifestyle is a major thing. Then there are many rituals to be practiced, to avoid any mental or physical health imbalances in the Sutika Avastha. All those I will, we will discuss it in some other session. There are certain herbal support or herbo-mineral support, which enhances the stress reducing properties, and which supports the mother's mental well-being during the postpartum period. So there are so many herbs, there are so many rituals, dinacharya and rutucharya, according to the season and according to the daily routine. There are so many things which can be done, and Ayurvedic therapies in some of the cases, panchakarma and other Ayurvedic therapies are also, administered according to the prakriti of the mother. See, Ayurveda offers holistic principles and practices for postpartum care. It is, if you think of, for brief, this is that, Ayurveda approaches here are complementary to modern and medical interventions, in psychologically managing postpartum depression. I have only talked about psychological management, okay? I have not talked about the physical management of it, because it requires a team. If there are any physical symptoms, so physically also it needs help, and psychologically also it needs help. So, and I think for today, this is good enough for today. That's it for today. We'll discuss some it in detail. What is the management, and what can be done in Ayurveda and modern? What do we do? Psychotherapy and talk therapies. What all can be done? I'll discuss it in the next session. So, thank you for staying tuned, and please feel free to share your thoughts in the comment section below. And namaste for today.